have Santa Claus in our local group talking about sex. And again, this guy was a delight. He was so incredibly good. And one of the things that he said is it's important that we really all understand. And for those of you who just joined on YouTube, we just started it for the third time because we're having audio issues. And you've entered now in this discussion about sex. Okay. So one of the points that he made is, listen, you have to understand that sex changes over time. That when you're young and you're a teenager or you're in your 20s, sex is very fast. Slam, bam, thank you, ma'am. You know, it's okay, no echo. Okay, on that microphone. Okay, interesting, strange. We'll keep that up. So when you're young and you're in your first sexual relationships, it's very quick. And it's all about getting to the end, right? And as you get a little bit older and you enter your late 20s, your early 30s, then, there's a little bit more comforting and a little bit less about quick, a little bit more about cuddling, all that sort of stuff, right? And then in your 40s, it's kind of even Steven. Yeah, it's about the physical act, but it's also about the cuddling and the nurturing and all that sort of stuff. 50s, you just kind of see this slow shift, right? Until, finally you reach that age where you're in your 80s or your 70s, or you have, let's just say a bad hip or something like that. And all of a sudden, the act of intimacy, the intimate intercourse is physically difficult. But does that mean that you as a couple cannot be intimate with each other and love each other and be kind to each other? Of course not. Because as you get older, sex is a lot more about the comforting and the quiet moments and the being with each other and the massages than it is about the quickie, kind of, sort of. That's just kind of the general trend. Okay. So anyway, so he said, listen, I want to tell you about one of my clients. And I have to tell you right now, I envy this couple. I have never seen a couple so incredibly intimate and connected than this couple. In fact, I don't even know why they come see me. And we're like, okay. He goes, well, you need to understand something. He was in the war. We're like, okay. He goes, no, he was hurt in the war. Oh, and he goes, guys, he lost his penis in the war from a landmine. So my question to you is, how can a man without a penis have a sex life that other men absolutely envy? And that was a question he posed to us as a group. And the answer, of course, is outer course. That in tantric sex or outer course, it's not as much about the inner course. It's about using touching and loving and stroking and kissing and all that sort of, getting your partner to that point right before orgasm. That point that, gosh, if you're lucky, it lasts a minute. If you're unlucky, it's gone, right? So the goal of tantric sex is to get your partner to that point where everything is just feels absolutely great. Orgasm is imminent. And then your goal is to keep them there for an hour through touching, loving, stroking. Not intercourse. And he said, listen, if intercourse happens, fine. The advantage of doing it that way is when it's finally time to actually have intercourse, it's going to be really quick. 1 thrust, 2 thrusts, you're done. And he said, the challenge here, the joy here of doing it this way is that even if you don't have intercourse, both partners are so incredibly satisfied that they have a sex life that I, as a doctor, envy. So anyway, in my group, we were meeting at Petaluma Valley Hospital back then. I had young couples. I had a very elderly couple. I had straight couples. I had gay couples. I had all sorts of couples in our meeting. And so at the end of the meeting, they're all walking out and they got their heads together and going, okay, this is interesting. We should try this, right? And they were quite animated as they were walking out of the room. And it's like, okay, we did our thing. Well, a month later, we had our meeting again, and they walked in glowing, glowing. And the couple that glowed the most was the elderly couple. They were in their late 70s. And they just flat out said, if only anybody had told us about this when we were in our 20s, our sex life would have been so much better. Right? So, how can a man without a penis have a sex life that other men envy? How can a doctor who counsels couples for pain with intimacy absolutely envy one of his clients? Because they were masters at outer course. And so you got nothing to lose. Now, I just something else about sex. I think it's very important. My first year with my severe bladder pain, and remember, I don't have that pain anymore. Okay, I don't have that pain anymore. I just like do not come close. Forbidden territory. Do not touch my body. My pain was so severe. It's my poor boyfriend at the time, Todd. I don't even know what he thought. Right? Oh God. And I just couldn't even fathom having sex. I mean, it's just the pain was so severe back then. And I went to my doctor and I said, "All right, what about sex?" And he's like, "What do you mean?" It's like, I don't want to have sex right now. Everything hurts. He goes, "Jill, you don't have to have sex. If you want to wait 6 months, you want to wait a year, fine. You absolutely do that." And of course, now I know why sex was so painful, because I was a pelvic floor patient, right? But I didn't know that back then. So I took a break from sex for like almost a year, I think, right? And then when it was time again, I realized that I had completely lost trust with my body, completely lost trust. And it is very unfair to expect your partner to figure out what hurts if you don't know what hurts first. And so I don't remember who I talked to at that time, but what they said to me was, you got to figure it out on your own. You got to figure out what hurts and what doesn't hurt. It's that simple. You know what I'm talking about. And once I did that, and I was able to say, yeah, you can do this, but not that, it was better again. And of course, when we finally figured out that I was pelvic floor driven and I did pelvic floor physical therapy and I got my muscles healthy, sex was fine again. Okay, hold on a sec. Bobby says, is it okay to take bladder builder long term? So somebody asked Dr. Parsons that question about Elmeron. The question was, will I have to take Elmeron for the rest of my life? And his answer was, no. You just have to figure out if it's helping you. So how do you do that? You reduce the dose. So if you take 4 a day, what he said is go to 3 a day. See how you do. If your symptoms get worse, maybe the med's helping you. If it's not, maybe it's not. So go to 2 a day. Go to 1 a day. Stop taking it. And if your symptoms don't change, then clearly the med's not helping you. And I think you can kind of apply that to bladder builder. You know, there's no data about the long-term use of chondroitin that I'm aware of. And so my philosophy with supplements for me is that I will do something for a period of time, and then I will take a break for a period of time. Like I'm taking a break right now from Piora. I haven't taken it for about a month. And that's what I tend to do whenever I'm taking supplements like that. And then if I start feeling my nerves acting up again, I will probably start taking it again. Anne says, I'm afraid that will happen to me. I've been daring lately, eating tomatoes. Well, if you're going to eat tomatoes, eat fresh tomatoes off the vine, preferably yellow tomatoes. They're lower in acid. Danielle says she wants out of this nightmare. Honey, if you want to talk, call me this week and I'd be happy to talk to you. Aww. Renee says, I'm seeing a pelvic floor therapist and using an estrogen-based cream. She's doing internal work on me. She has me on a bladder diet. Also seeing a urogynecologist who's doing installations with heparin and lidocaine and a low dose of Keflex. I was starting to get frequent UTIs. Thank you so much for describing pelvic floor dysfunction. Where can I buy one of those wands? Right in the IC Network shop, hon. Just go to icnetwork.org and click on our store link or our shop link, and you'll find it under physical therapy supplies in our shop. Sharon says, my son said the shiver all over my body tingle is most likely telling me it's an infection as an ER person doing triage. Okay. Not what I need. I'm just getting over leg surgery 10 days ago. Now, Sharon, you didn't say you're getting over leg surgery 10 days ago. So you could have a nosocomial bladder infection from that leg surgery. You could have picked up surgery. You could have picked up the infection from that surgery 10 days ago. And so I think I'm going to agree with that with your son. I think nosocomial infection from hospitals and from having surgery are very common. Some hospitals have more problems with it than others. And given that scenario, I would call the surgeon's office and tell them that you're shaking and that you might have an infection and you need to get into the doctor and get that checked out, girl, sooner rather than later. Anne said, can you get internal work done rectally from pelvic floor therapists for constipation? Yes, you can. Because physical therapy, pelvic floor physical therapy is done rectally for men anyway. And it has been done rectally for women too, depending upon which muscles they're working on. And so it's absolutely possible. Sure. Sue says, sepsis can make you shake. The one time I ignored the shakes when they were really bad, I had a kidney infection, but that's the trouble with her condition is you can never really tell. Yeah, Sharon, I think you need to head over to urgent care today. I would call your doctor, talk to the on-call doctor, and get yourself checked out, girl. You need to get yourself checked out. Given that you just had surgery 10 days ago, that's I think that's a pretty strong risk factor for a UTI, or as Sue said, maybe even sepsis. So I would be proactive and just get yourself over there, get it figured out. You know, nobody likes to go to the emergency room. Nobody likes to go to urgent care, but that's where we have to make sure you're okay. And if you're scared, go. If you don't understand why you're feeling so badly, go. That's what you pay them for. Maybe you can call somebody and see if you have an urgent care clinic available to you. So out here in California, if you have United Healthcare or Providence, they have urgent care centers that are open during the day. So you don't have to go to the emergency room. You can just go to an urgent care center if it's something like obviously not your heart. And the line is usually non-existent. Whereas, when we took my mom to the emergency room and my dad to the emergency room in May, oh my God, there was every seat in the waiting room and people were standing and going back into the ER. There were people sitting in hallways and laying in hallways on gurneys. So urgent care is often a much quicker and better way to get an answer to, do I have a bladder infection? Sue said, did they give you catheterization when you had your surgery? Yeah. If they had a catheter, if you had a catheter, even just during the surgery, That's how the bacteria got up there, and that's how nosocomial infections start, right? All right, so you guys on YouTube, you're better now? Maybe my Logitech microphone went belly up. It's possible. Good, Betsy, I'm glad. I am glad. Now, the echo is gone. Excellent. So I wanted to read you the press release for IC Awareness Month. Even though I didn't have it finished last weekend, I want to read you the finished one. So this is for immediate release September 1st, 2023. Imagine being told you have an incurable disease that will leave you in severe pain, unable to work, sleep, enjoy intimacy, unable to eat or drink your favorite foods, and leave you virtually tied to a restroom for the rest of your life. Yet for millions of women, there is no disease and the condition is treatable. Quote, many women have been told that they have an incurable bladder disease, interstitial cystitis or bladder pain syndrome, when their symptoms are actually the result of estrogen loss, offered Jill Osborne, founder of the Interstitial Cystitis Network. Quote, known as genitourinary syndrome of menopause or vulvovaginal atrophy, their symptoms of urinary frequency, urgency, burning, pain, and recurring UTI often begin after a total hysterectomy, the use of medications which suppress estrogen, or simply with aging. Estrogen loss is the root cause for women whose urinary symptoms begin as they age. One study of 2,000 women in Britain found that 50% of women between the ages of 55 and 85 years of age experience urogenital symptoms, some quite seriously. An estimated 20% of women between the ages of 40 and 45 years of age also struggled with symptoms. Quote, as estrogen levels decline, changes occur in the urethra, bladder, vaginal vestibule, and labia, resulting in a dramatic reduction in skin health and quality. This, in turn, makes the skin more vulnerable to chemical irritation and infection, offered Ms. Osborne. Young women using birth control might also find themselves urinating more frequently due to the suppression of estrogen. One 18-year-old developed urinary symptoms 2 weeks after starting birth control pills that resolved once she stopped them. Quote, in 2023, our goal is to help IC-BPS patients differentiate between cause and effect. Rather than chasing the symptoms with medications, we want to identify the underlying cause so that the most effective treatments can be utilized, offered Ms. Osborne. She continued, for the GSM patient, the primary focus should be on improving the quality and health of the skin, usually with topical estrogen cream. Sadly, some patients don't consider using estrogen therapy because of misinformation about its safety. And some prematurely stop using estrogen when their symptoms don't immediately improve. Estrogen therapy takes time. Physicians are now utilizing phenotyping to provide a more individualized diagnostic workup. For example, pelvic floor dysfunction is found in an estimated 85% of men and women struggling with IC-BPS. The American Urology Association guidelines for IC suggest that any patients with tight muscles be referred immediately to physical therapy. September 1st launches the annual IC Awareness Month campaign. We want patients and providers to step back and reconsider the diagnosis of IC in patients not responding to treatment with GSM, pelvic floor dysfunction, or another condition missed that could be treated. Learn more about IC Awareness Month at icawareness.org. So again, you can download this as a PDF file and you can send it to your local paper, and I hope you'll do that. Because it costs like $1,000 to send it out via the news services, the wire services. Sharon said she did not have a catheter, but she had a phlebectomy on her leg. I was sedated, but could move when they asked me to. I don't remember anything. They were extremely thorough about the prep before surgery. They might have been extremely thorough, hon, but if you've got an infection, you got an infection. It's just that simple. So they've got to rule it out for you, hon. They just have to rule it out. Okay, guys, so I will continue as long as you have questions for me. So let's get some questions. You got any more questions for me? Otherwise, the other thing I could do is I could read some of these success stories from my favorite book, Breaking Through Chronic Pelvic Pain, to help you understand cause and effect and how treatment should be done. Here's a great story about double crush syndrome when you fall badly and hurt the nerves in your pelvis. Sharon says, almost all the micro incisions are healed, just a couple on my knee that were really big veins. Yeah. There we go. Let's talk about pudendal nerve entrapment. Betsy says she's afraid of physical therapy that you're afraid it will cause a flare. Girl, seriously. If physical therapy causes a flare, then we know you're doing exactly the right thing. Remember, that's what I call your hallelujah moment. If you go to physical therapy and they touch a muscle and trigger pain, that's exciting. Because your answer is going to be, that's it. What are you touching? Please tell me what you're touching. That's causing my pain. And I am living proof that physical therapy is a fantastic way of finding the underlying cause and treating it. Don't be afraid of physical therapy at all. Maybe you just need to read about it a little bit more. Maybe you need to, again, I would invest in this book, Breaking Through Chronic Pelvic Pain, because it will teach you everything about those muscles, and it will help you understand just how and why physical therapy should be formed and what it does to make it so successful. So let's, pudendal nerve entrapment, IC subtype 4. These are patients who have pain when they sit down that gets better when they stand up, right? Anytime you have positional pain, that means that we have a muscle that's squeezing nerves. Something is squeezing nerves. Good, Sharon. So let's go to his chapter 10. And this is treatment strategies for pudendal nerve entrapment. And the subtitle is, You're Sitting on What? This may come as a surprise, but you, the patient, hold one of the most important keys to the successful treatment of pudendal nerve entrapment. Believe it or not, your practitioners can perform every treatment trick in the book and accomplish very little if you don't pay close attention to what you sit on, wherever you may be. This is a basic requirement for minimizing trauma to an already grumpy pudendal nerve. Many of my patients actually choose their restaurants not by the food on the menu, but rather by the chairs at the tables. One gentleman told me he once walked in and out of 3 restaurants before he found a seat that didn't frighten him. This extreme tactic can usually be avoided, however, with the use of a special cutout chair cushion you can carry with you to these places where seating is likely to be suspect. And just know, we have excellent, excellent chair cushions on our website that are perfect in this scenario. He said, these include theaters, stadiums, banquet halls, waiting rooms, public transportation, or even your friends' homes. In other words, don't go anywhere without it. If you encounter a hard surface or one that pushes up between the sit bones, put your cushion down and tell curious onlookers it's for your bad back. As for your own home or office, it goes without saying that you will be sitting on these cushions here. And I can show you. You know what? I've got them right here in my closet. Hold on. Here you go. Here you go. This is a fab cushion. Look at this. If you've got pain anywhere in your crotch, from the front to the back, from the clitoris to the rectum, the urethra, prostate, anywhere, this is exactly the type of cushions you want to sit on. Because what you're going to see is each butt cheek is supported, but nothing is pushing up against your tender bits. Nothing is pushing up against that tender, vulnerable nerve. So this is the travel cushion. All right. Okay. Love this cushion. Love this cushion. Eric's story. Eric's story poignantly illustrates how the simple act of sitting in the wrong chair can inflame and entrap the pudendal nerve with potentially devastating consequences. It also highlights the need to educate physicians to recognize pudendal nerve pathology and make a correct diagnosis when evaluating pelvic pain complaints. Eric was 36 years old at the time of his initial visit with a 10-year history of pain with sitting. He described the sensation of a golf ball up his rectum and perineum with a soreness at the base of his penis and under the right sit bone. He also mentioned that on several occasions he had experienced pain in the urethra, testicles, and lower abdomen. It all began when he sat on a weird chair with a lump in the middle. And since he initially had urethral and scrotal pain with a hesitant and slow urinary stream, he was referred to a urologist who prescribed antibiotics and Flomax. The question not answered was why Eric had his pain symptoms only when sitting in a chair. After seeing 20 urologists and taking as many courses of antibiotics for presumed prostatitis, the pain with sitting remained. This 27-year-old man in a very lucrative profession had to quit his very lucrative job. He was unable to focus enough to do any work. Fortunately, his wife, who enjoyed sewing, wanted to help, and after much experimentation, she constructed a cushion with a cutout in the center that significantly reduced his discomfort. And it then occurred to her to market the cushions to patients with prostatitis who, like her husband, had pain with sitting. It was a stroke of luck for Eric when a patient of mine purchased one of his wife's cushions. The gentleman brought it to my office because it found it helpful for his pudendal nerve pain. I was intrigued with the cushion and thought it might benefit some of my other patients, so I phoned Eric's wife to request a sample. When she related her husband's story to me, I explained that his symptoms were not those of prostatitis and suggested I have a phone consultation with him. He called immediately, and our conversation led to an office visit. Eric's pain with sitting was in the distribution of the pudendal nerve, the perineum, the scrotum, the penis, and the urinary sphincter. On examination, he had very tender skin around the anus, both with pinching and pinprick. When I touched the left pudendal nerve, it was so tender that he almost jumped off the examining table. The diagnosis of left pudendal nerve entrapment was made, and he was treated with a cortisone nerve block. The pain subsided immediately, and he was able to urinate better than he had in 10 years. Eric then broke down and began to cry. Imagine having had 10 years of pain, unable to work, with a life on hold, and not seeing any further hope for relief. He had been alive but not living. If it had not been for his wife's cushion that found its way to my office, this young man with a once promising future might have been sentenced to a life in a pain prison. And he says, cars pose another challenge. My office is now well supplied with cushions, and every PNE patient is encouraged to use one. However, in spite of the use of the cushion, many PNE patients still complain about pain when driving. In fact, symptom flares from car seats have prompted some of them to either sell their cars or attempt to have a custom seat fabricated. One patient commented that her friends thought she was crazy when she sold her beautiful new Mercedes because she couldn't take the pain from the stiff, hard seat. Oh my God, that's so true. Another patient made an interesting observation. He had developed numbness in his buttocks and pain in his posterior thighs when driving his 1990 automobile. In 1993, when he purchased another vehicle with a softer seat, both symptoms cleared. Then in 2000, after seven symptom-free years, he returned back. He had a return of the buttock pain when he sat on the hard seat of his new car. with these new patient anecdotes in mind, I asked, okay, well, anyway, there's this whole section on how to shop for a car in here, which is very similar to how on my section on how to shop for cars. Anyway, love this book. So Danielle says, how do you cure a bad nerve? Number one, you calm the nerve down. Number two, you don't irritate the nerve further by sitting on it in a bad way, right? If you have pudendal nerve entrapment. And so this PEA is an example of a way to calm nerves down. But gabapentin, lidocaine cream, using a lidocaine gel on your skin to calm the nerves in your surface of the skin would also be helpful. You should get this book so that you can read about how they treat pudendal neuralgia. It's on the IC Network website in our shop. Marlia said, so I haven't had spaghetti sauce for 5 years and craving it. Someone in my IC support group suggested to cook my favorite spaghetti sauce with a peeled potato and a pinch of baking soda. So I tried this, ate a small bowl of spaghetti and sauce. Yesterday, ate a small meatball sub with said sauce, and Yahoo, no bladder pain. Just wanted to pass this along. We're all different, but my Italian heritage was screaming for spaghetti. Yeah, girl. So really what you did is you alkalinized it with the potato and with the baking soda. In fact, years ago, there was a tomato sauce that was sold with baking soda in it as a low acid tomato sauce. It just didn't sell. Another way of dealing with that acid is just taking some Pre-Leaf, which is an over-the-counter supplement. They happen to be a sponsor of our website. And if you haven't seen this before, uh-oh, what fell over? Oh, I see what fell over. Pre-Leaf is the most popular supplement on the market today by far. It is used by thousands of patients who have acid sensitivity in their stomach or in their bladder. And you just, take a caplet or two when you're going to eat something, right? And it will reduce. I mean, they have the acid charts on their website. It has a remarkable ability to reduce acid, okay? Helene says, my flares lasted for the first 2.5 months. Now I enjoy pelvic floor physical therapy because she's always finding tight muscles and releasing them, and I feel so great afterwards. Yeah. And that's why learning how to do it at home is so important, because when you feel those muscles tightening up, you can directly intercede and stop those muscles from doing that. So it's great. Sue says, I don't know why the car seats got so hard and less foot room in the last 20 years, but it's definitely harder to travel the way they construct new cars. I miss my old Chevy minivan. I was shocked. So I couldn't, my first 5 years, I could not sit in a car for 5 years without crying. I had a Mitsubishi, killed me. My mother had a Dodge Dynasty, so an American sedan. You would think that would have been good, but it had a shimmy to it. So I had terrible flares in that. The only car that I could drive in comfortably was my dad's Crown Victoria, Ford Crown Victoria, police car. And I still have his last Crown Victoria right now in the driveway. So back then, his car is a 1999. The seats were just so cushioned, and the ride was so smooth, and the suspension in the car was so smooth. I could pretty much get anywhere in that Crown Victoria. So finally, when it was time for me to actually buy a car again, I drove every car I could find. I drove cheap cars, I drove expensive cars. I drove European cars, Asian cars, American cars. And all I wanted was to not be in pain when I hit a bump in the road. And so like the Volvo sedan had a great suspension, but the seats were like hard leather. The Nissan Murano was like my number 2 choice. Tiny, it was kind of okay. But I ended up, the car that I ended up buying that I drove for years that I missed desperately was a Buick SUV. It was called the Buick Rendezvous. And the cushions were fantastic, super quiet, super suspension. I could go anywhere in that Buick. It became our family's favorite car. And I had it for like, well, let's see, I had it from 2003 to 2017, 14 years. And finally it gave up the ghost. And I had to get a new car. And I was shocked that even Buick doesn't make the soft seats anymore. Yeah, they're as hard as a rock. I don't understand it. I simply do not understand. So I went and test drove cars last year. The first place I went was Buick. I couldn't even sit in the freaking car because now they have this raised bumper. So it's like a toilet seat of hard leather. And in the very back, there's like this raised bar that pushes right up against your tailbone. And God darn it, that hurt. So I ended up with I have a Nissan Rogue, which I do not like because it's loud, but the seat is comfortable. But the Nissan Pathfinder, no. The Nissan, is it the Nissan Pathfinder? Their larger SUV is probably the next one I might get. I just don't have the money for it right now. Danielle said I had a Buick LeSabre. It was so beautiful. It was like sitting on a couch. Exactly. Sharon says I have a Buick Lucerne with power seats, heated seats is my saving grace. Exactly. Man, those Buicks, awesome. And a lot of people say, why would you want to drive an old person's car? Because it's so comfortable. And the customer satisfaction rate with Buick was sky high. Sue says, I was told they don't use springs anymore. They use a strapping system, and it has to do with heated, air-conditioned seats. Personally, I think they just found a cheaper way to make some of them, and then just throw some memory foam in there. Yeah. Sharon says, the suspension of my Buick Lucerne was like sitting in my living room. Exactly. Sue said, none of the Buicks have those seats anymore. I just tried them all out. I know, right? It's so disappointing. So go try the Nissans, because with the Nissans, at least you don't have the bumper in the back. And there was one Ford, the Ford SUV, like the mid-side Ford SUV also had a pretty good seat. But I'm so disappointed in Buick. I'm so disappointed. Kind of heartbreaking, and I just saw it today. I saw somebody driving a Buick Rendezvous, and I'm going, oh God, I should have just paid for a new engine and kept it. I mean, the engine went out and what, $600? I should have just, and then I gave it to my nephew in Oregon, and God only knows whatever happened to my old car. I miss that sucker. Oh, you ended up buying a GMC Terrain, which felt comfortable when we bought it, but anything longer than a half hour and I'm in pain. I wish I drove it longer. Renee says she's got a 2006 Toyota Corolla. The seats are so comfortable. It only has 75,000 miles on it. Sue, you should go try the Nissan Rogue. The suspension's pretty good. The seats are pretty comfortable. They're not as good as a Buick, but they're not bad. And especially that next one up from the Rogue, the Pathfinder. No, what is it? Is that the right word for the? Hold on. Let me go to their website real quick. The biggest reason why I'm very frustrated with the Nissan Rogue is the road noise is ridiculous. Yeah, it's the Pathfinder. So I did sit in a Pathfinder right as COVID was hitting, and then we couldn't get it. Everything was held back because I needed a bigger car to try to evacuate 3 people during fire season. David says, sugar okay to have in small quantities. I wouldn't be doing a lot of sugar because sugar can promote inflammation, but I think you don't have to starve yourself. Artificial sugar, not okay at all of any type. Danielle said, I have a 2007 Chrysler Sebring. It's a piece of junk, the most uncomfortable car ever. You know, Danielle, I gotta agree with you. Like my mother loved, so Chrysler and Dodge, same company. Like Chrysler, I think it's a more expensive version. Dodge is a cheaper version. And Dodge was fantastic, they said in the 60s and the 70s, but not so much anymore, that's for sure. It had the weirdest shimmy to it. I had wicked pelvic floor flares driving her car or sitting in her car for a long period of time. And it was kind of like the car was just like moving like at this weird angle upwards. It was very strange. If you can, look for an old Buick sedan. You know, if you don't mind buying a used car, look for an old Buick sedan. Betsy said, I drove a 2000 Land Cruiser, never want to give it up. I drive a 2000 Land Cruiser, never want to give it up. You know, I thought the Toyota seats were too hard. I just thought they were too hard for me. And I went to Subaru. Subaru's. So I went to Subaru. I went to Volkswagen. I went to Mazda. I went to Lincoln. All last year. Because again, I was looking for a bigger SUV to evacuate 3 people. And the Subaru cars were nice, but the seats were just too hard. They are. It's just so disappointing. But when I went to the Ford dealer, and you know, Ford kind of has a credibility problem with their engine durability. I was with an older salesperson and I just let it out. I said, listen, I cannot, I have an old pelvic injury. I have nerve damage. I have to have a soft seat. And he goes, I know exactly the car I want you to sit in. And it was that mid-level Ford sedan, and it was dreamy, but it was about the same as my Rogue in terms of size. So it wasn't it wasn't worth getting. I had to get something bigger. So what is it? The Edge, the Ford Edge. That was very close to my old Buick seat, the Ford Edge. Sue says, my mom's got one with less than 50,000 miles of it sitting in the garage with very comfortable seats. I told her I would love for her to leave it to me because you just can't find a car with seats like that anymore. Sue, why don't you buy it from her? You know, just if you can, offer her a couple $1,000s for it. You know, maybe she could use the money and maybe you could just pay on, you know, pay small amounts over time to try to get it. But that would be, I mean, I would go for it. Danielle said, I heard you talking about sugar. My biggest problem, because I'm trying to put on weight, as I eat almost a pint of ice cream every day, I was when training, if that could be asking if that could be trouble down in paradise. Now, the problem with the ice cream is the milk sugar and the fact that you're creating a perfect environment to fungus to grow. It would be better if you could add like almond butter or peanut butter every day. That's what I had for breakfast. I had almond butter on toast. Because almond butter is a good healthy fat without all that sugar. Sharon says, my Buick Lucerne 2008 is 15 years old, but I only have 127 7,000 miles. I'm hoping to keep driving it for a while. The car has everything to make life comfortable. It's quiet and huge on the road with wide tires. Leather seats with power and heated seats. My Buick is better than any Chrysler I ever drove, including the Chrysler Cordova my husband bought me new for having a baby girl. My dad was a Chrysler man. See, my dad was a Chrysler and a Dodge man. Sue said it's not the seats either. The legroom is smaller because of all the airbags and safety features, and I'm tall and I have long legs. That's even in larger vehicles. There's just not the same amount of legroom, and I need to shift my position often. Yeah. Sue says she still drives even though she's 87. She doesn't want a new car with all the electronics. It would be too confusing for her. Yeah. Sharon says, I drove a Buick Envision last time they worked on my Buick. It wasn't too bad. Problem I had is it was made in China. My Buick Lucerne was built in the USA. Yeah, you know, I thought that the seat in the Buick Envision was hard. I felt like I was sitting down into a sports car with a very hard seat. I tried it. I didn't like it. Sue said, I like cashew butter, only nut butter that doesn't give me acid reflux. Unfortunately, it's like $12 for a small jar. Sharon says, my dad's radio handle was Mr. Mopar. Aw. That's cool. That's very, very cool. All right, guys. Well, listen, I think we've come to the natural end of this meeting. It is 3 o'clock. And I think I'm going to go see Barbie. Yesterday, I worked for hours and hours in the morning and took a shower, and I went and saw Indiana Jones, my first movie after COVID. And I was talking with the movie theater, and they said, you should go see Barbie too. It's great. The show's at 3:45. It's 3 o'clock now. So I think that's what I'm going to do. So just remember, IT Awareness Month starts in a couple of days. It's not about me. It's about you. And what are you willing to do about it? As always, if you have any questions, you're welcome to give me a phone call, 800-928-7496. And if you find these meetings helpful, please think about becoming a member so that you can get our wonderful magazine, The IC Optimist. All right? Okay, my friends, I will see you later. Have a good one. Okay, Facebook is down. All right, YouTube. Sorry about the sound issues today. Very weird. That's technology for you.